Right now, as you watch this video, there's a 1 in 7 chance that something is happening inside your body that could be slowly draining your energy, affecting your hormone levels, and potentially compromising your ability to father children in the future. And the worst part? Most men have absolutely no idea this is happening to them. Before we continue, make sure to subscribe to the channel so you don't miss any important tips on men's health. Hit the bell to stay updated with all the latest videos. This condition affects approximately 15% of all adult men, yet it remains one of the most overlooked and misunderstood aspects of male health. It's responsible for up to 40% of male infertility cases, can significantly impact testosterone production, and has been linked to chronic discomfort that millions of men simply learn to live with, thinking it's normal. But here's what makes this truly alarming. The longer this condition goes unaddressed, the more severe the consequences can become. And many men only discover they have it when they're already facing serious complications. What we're talking about is varicocele, a condition affecting the veins in the scrotum that could be silently impacting your health right now. By the end of this video, you'll understand exactly what varicocele is, how to identify if you have it, what natural approaches can help manage it, and when professional intervention becomes necessary. Stay with us, because what you're about to learn could literally change your life. Let's start with the basics, because understanding what's happening in your body is the first step toward taking control of your health. A varicocele is essentially an enlargement of the veins within the scrotum, specifically in the pampiniform plexus. Think of it as similar to varicose veins that some people get in their legs, but in this case, it's happening in the veins that drain blood from the testicles. Here's what's actually occurring. The veins in your scrotum contain one-way valves that normally allow blood to flow from the testicles back toward the heart. When these valves malfunction or fail, blood begins to pool in the veins, causing them to enlarge and become twisted. This creates a backup of blood that wasn't meant to stay there. Now, you might be wondering, why does this matter so much? The answer lies in temperature regulation. The testicles hang outside the body for a very specific reason. They need to maintain a temperature that's approximately 2 to 4 degrees Celsius cooler than the rest of your body. This cooler temperature is absolutely critical for optimal sperm production and testosterone synthesis. When blood pools in the varicocele, it raises the temperature around the testicles. This increased heat can have cascading effects throughout your reproductive system and overall hormonal health. But temperature isn't the only issue. The pooled blood can also lead to increased oxidative stress in the testicular tissue. Think of oxidative stress as cellular rust, damage caused by unstable molecules called free radicals. This oxidative environment can harm the cells responsible for producing both sperm and testosterone. Additionally, the backward flow of blood can sometimes carry metabolic waste products and potentially harmful substances from the kidneys and adrenal glands back into the testicular area, creating what researchers call a toxic environment for the delicate processes of hormone and sperm production. But here's what most men don't realize about varicocele, and it's crucial you understand this before we go any further. Varicocele typically develops during puberty, when the testicles are rapidly growing and blood flow to the area increases dramatically. In approximately 85% of cases, it occurs on the left side. This isn't random. There's an anatomical reason. The left testicular vein is longer and enters the renal vein at a right angle, creating more resistance to blood flow and making valve failure more likely. The condition is classified into 3 grades based on severity. Grade 1 is the smallest and can only be detected during specific physical examination techniques when a person bears down, increasing abdominal pressure. Grade 2 is moderate and can be felt during a normal physical examination without any special maneuvers. Grade 3 is the largest and most severe, visible through the skin of the scrotum without any examination, sometimes described as looking like a bag of worms due to the enlarged, twisted veins. Understanding which grade you might have is important, but here's the critical point that many men miss. Even smaller varicoceles can cause problems. Don't assume that because you can't see or easily feel something, it's not affecting your health. Now that you understand what varicocele is, let's talk about recognition, because many men live with this condition for years without realizing it. The challenge with varicocele is that it can be completely asymptomatic, especially in its early stages. Some men go their entire lives never knowing they have it. Others experience clear symptoms that progressively worsen over time. Here are the primary signs to watch for. Physical symptoms in the scrotal area. The most common complaint is a dull, aching pain or feeling of heaviness in the scrotum. This discomfort typically worsens throughout the day, especially after prolonged standing, physical exertion, or exercise. Many men notice the discomfort decreases when lying down, as gravity no longer pulls blood into the dilated veins. Some describe a dragging sensation, as if something is pulling down on the testicle. Others report a throbbing feeling that comes and goes. The pain is rarely sharp or severe, which is why many men dismiss it as unimportant or just accept it as normal. Visible or palpable changes. With larger varicoceles, you might notice that one testicle appears smaller than the other. This shrinkage, called testicular atrophy, occurs because the elevated temperature and oxidative stress damage the testicular tissue over time. If you notice this, it's a sign that the varicocele has been present for a while and is having measurable effects. You might also see or feel enlarged, twisted veins above or behind the testicle. Some men describe this as feeling like a bag of worms when they touch the area. The veins may become more prominent when standing and less noticeable when lying down. But here's what concerns most men when they finally learn about their varicocele. Fertility concerns. Many men first discover they have a varicocele when they're evaluated for infertility. Research indicates that varicocele is present in approximately 35 to 40% of men with primary infertility, meaning men who have never been able to father a child despite trying. It's found in up to 80% of men with secondary infertility, meaning men who previously fathered children but are now having difficulty. The mechanism is clear. Elevated scrotal temperature, oxidative stress, and the toxic environment created by pooled blood all work against healthy sperm production. Sperm count may decrease, sperm motility may be reduced, and sperm morphology may become abnormal. Hormonal effects. This is perhaps the most underappreciated aspect of varicocele, and it's something that affects men whether they're concerned about fertility or not. The same factors that harm sperm production also interfere with testosterone synthesis. The Leydig cells, which produce testosterone in the testicles, are highly sensitive to temperature and oxidative stress. When these cells are operating in a compromised environment, testosterone production can decline. Low testosterone doesn't just affect libido and sexual function. It impacts energy levels, mood, cognitive function, muscle mass, bone density, and metabolic health. Men with varicocele often report feeling chronically fatigued, experiencing brain fog, struggling with motivation, or noticing decreased athletic performance without understanding why. And here's something that will surprise you about the progression of varicocele symptoms. Many men assume that if they've had a varicocele for years without problems, they're in the clear. But varicocele can be progressive. The vein dilation can worsen over time. The temperature effects can accumulate, and the oxidative stress can compound. What starts as a grade 1 varicocele in your 20s might become a grade 2 or 3 by your 30s or 40s, with increasingly noticeable effects on your health. This is why early recognition and proactive management are so important. You're not just addressing current symptoms, you're preventing future deterioration. Now we come to what most men want to know. What can you actually do about this naturally? While severe cases of varicocele may require professional intervention, there are numerous evidence-based natural approaches that can help manage the condition, reduce symptoms, and potentially slow or prevent progression. Since elevated scrotal temperature is a primary mechanism of varicocele damage, anything you can do to keep the area cooler is beneficial. Avoid prolonged sitting, especially in warm environments. If your job requires long periods of sitting, take regular breaks to stand and walk. Even 5 minutes of standing every hour can make a difference in blood flow and temperature regulation. Be mindful of hot baths and saunas. While occasional use may not be problematic, frequent exposure to high heat can exacerbate the temperature issues caused by varicocele. If you do use hot baths or saunas, limit duration and frequency, and always follow with cooling. Your clothing choices matter more than you might think. Tight underwear and pants can restrict blood flow and trap heat. Choose loose-fitting, breathable underwear, preferably made from natural fibers like cotton. Avoid synthetic materials that don't breathe well. Some men find that boxer shorts are better than briefs for maintaining cooler scrotal temperature. During exercise, wear supportive but not constrictive athletic supporters. After exercise, change out of sweaty clothes quickly and consider a cool shower to help normalize temperature. Your diet plays a crucial role in managing varicocele, primarily through its effects on vascular health, inflammation, and oxidative stress. Antioxidant-rich foods are your first line of defense. Berries, particularly blueberries, blackberries, and strawberries, are packed with compounds that combat oxidative stress. Dark leafy greens like spinach, kale, and Swiss chard provide vitamins and minerals essential for vascular health. Tomatoes deserve special mention. They're rich in lycopene, a powerful antioxidant that has been specifically studied in the context of male reproductive health. Cooking tomatoes actually increases lycopene availability, so tomato sauce, paste, and cooked tomatoes are excellent choices. Nuts and seeds, especially walnuts, almonds, Brazil nuts, and pumpkin seeds, provide healthy fats, vitamin E, selenium, and zinc. These nutrients support both vascular integrity and hormone production. A small handful daily is sufficient. Fatty fish like wild-caught salmon, mackerel, and sardines provide omega-3 fatty acids that reduce inflammation and support healthy blood flow. If you don't eat fish, consider plant-based omega-3 sources like flax seeds, chia seeds, and walnuts, though they're less potent than marine sources. But here's a dietary factor that most men completely overlook. Citrus fruits, particularly oranges, grapefruits, and lemons, contain compounds called bioflavonoids, especially diosmin and hesperidin. These compounds have been shown to strengthen vein walls, improve venous tone, and reduce venous insufficiency. Including citrus fruits or their juices daily can provide vascular support relevant to varicocele management. Garlic and onions contain sulfur compounds that support cardiovascular health and have natural anti-inflammatory properties. They also support healthy testosterone levels. Include them regularly in your cooking. Hydration cannot be overstated. Proper water intake ensures optimal blood viscosity and circulation. Dehydration makes blood thicker and harder to pump, potentially worsening venous pooling. Aim for at least 8 to 10 glasses of water daily, more if you're physically active or in hot climates. What to avoid? Processed foods high in trans fats and excessive omega-6 fatty acids promote inflammation. Excess sugar and refined carbohydrates create oxidative stress and can impair vascular function. Excessive alcohol can affect hormone balance and liver function, which in turn impacts testosterone metabolism. Limit or eliminate these from your diet. Exercise is a double-edged sword when it comes to varicocele. Done correctly, it improves circulation, supports hormonal health, and enhances overall well-being. Done incorrectly, it can worsen symptoms. Cardiovascular exercise that promotes blood flow is generally beneficial. Walking, swimming, and cycling, with proper seat adjustment to avoid excessive pressure, improve circulation throughout the body, including the pelvic region. Aim for at least 30 minutes of moderate cardiovascular activity most days of the week. However, avoid exercises that dramatically increase intra-abdominal pressure, especially heavy squats, deadlifts, and other exercises involving straining with held breath. This Valsalva maneuver increases pressure in the veins, potentially worsening varicocele. If you do strength training, Focus on moderate weights with controlled breathing, never holding your breath during lifts. Some men notice that symptoms worsen immediately after exercise, particularly standing exercises or heavy lifting. If this is your experience, modify your routine. Focus on exercises that can be done lying down or with elevated legs. Swimming is particularly beneficial as the horizontal position and water pressure both support venous return. After any workout, elevate your legs for 10 to 15 minutes. This simple practice uses gravity to help drain pooled blood from the scrotal veins, potentially reducing discomfort and supporting recovery. Many men are unaware that pelvic floor exercises can improve blood flow in the pelvic region and potentially help with varicocele management. These exercises strengthen the muscles that support proper venous function in the area. The basic pelvic floor exercise involves contracting the muscles you would use to stop urination midstream. Contract these muscles for 3 to 5 seconds, then relax for 3 to 5 seconds. Repeat 10 to 15 times, 3 times daily. You can do these exercises anywhere, anytime, without anyone knowing. As these muscles strengthen, gradually increase the contraction duration and number of repetitions. Strong pelvic floor muscles support better blood circulation and can reduce venous pooling. Excess body weight, particularly abdominal obesity, increases intra-abdominal pressure, which impedes venous return from the lower body, including the scrotum. Maintaining a healthy weight reduces this pressure and supports better blood flow. Additionally, excess body fat, especially visceral fat around organs, is metabolically active and produces inflammatory compounds. It also promotes the conversion of testosterone to estrogen. Both effects are counterproductive when managing varicocele. If you're carrying excess weight, gradual, sustainable weight loss through a balanced diet and regular exercise can significantly impact your symptoms and overall hormonal health. Sleep position matters. Sleeping with your legs slightly elevated or with a pillow under your knees can reduce overnight venous pooling. Some men find relief by sleeping on their right side, as this position may improve venous drainage from the left testicle, where varicocele most commonly occurs. Quality sleep itself is crucial for testosterone production, which primarily occurs during deep sleep stages. Aim for 7 to 9 hours of quality sleep nightly. Chronic stress elevates cortisol, which can suppress testosterone production and promote inflammation. Incorporate stress reduction practices like deep breathing exercises, meditation, progressive muscle relaxation, or activities you find genuinely relaxing. Now, before we move on to when you need to seek professional help, there's one more natural approach that many men have found beneficial, but it requires consistency. Brief application of cold to the scrotal area can reduce inflammation, constrict dilated veins, and provide symptomatic relief. Some men use cold compresses for 10 to 15 minutes once or twice daily. However, never apply ice directly to the skin. Always use a cloth barrier and limit application to 15 minutes to avoid tissue damage. This is about gentle cooling, not freezing. Some men report benefits from alternating warm and cold exposure, though this should be done cautiously and discontinued if it worsens symptoms. While natural approaches can be highly beneficial, it's critical to understand when professional medical evaluation becomes necessary. You experience persistent pain or discomfort in the scrotal area that doesn't improve with rest and the lifestyle modifications discussed. Pain that's progressively worsening, even if gradual, warrants evaluation. You notice a visible difference in size between your testicles. Testicular atrophy is a sign that the varicocele has been causing damage and needs assessment. You and your partner have been trying to conceive for 12 months or more without success. If you're over 35 or your partner is over 35, seek evaluation after 6 months of trying. Varicocele is a correctable cause of male infertility, but early intervention yields better outcomes. You're experiencing symptoms of low testosterone, persistent fatigue, decreased libido, difficulty maintaining muscle mass despite exercise, mood changes, or cognitive difficulties. While varicocele isn't the only cause of low testosterone, it can be a contributing factor. You feel a sudden, sharp pain in the testicle or notice rapid swelling. While these aren't typical varicocele symptoms, they could indicate complications or other conditions requiring immediate attention. A healthcare provider will perform a physical examination, typically while you're standing and then while lying down. They may ask you to bear down, similar to straining during a bowel movement, as this makes varicoceles more prominent. They may use ultrasound imaging to assess the size of the veins, measure blood flow, and check for any abnormalities. This is a non-invasive procedure that provides detailed information about the varicocele's severity. If fertility is a concern, a comprehensive analysis will be performed to assess sperm count, motility, morphology, and other parameters. Hormone testing may be recommended to measure testosterone and related hormones, providing insight into whether the varicocele is affecting your hormonal balance. For smaller varicoceles that aren't causing symptoms or measurable problems, watchful waiting combined with the natural approaches we've discussed is often the recommended approach. Regular monitoring ensures that if progression occurs, it's caught early. For more significant varicoceles, especially those affecting fertility or causing persistent symptoms, various procedures exist that block off the affected veins, redirecting blood flow to healthier vessels. These procedures have high success rates for improving both symptoms and fertility parameters. Here's what many men don't understand about the timing of professional intervention. If you're planning to have children in the future, even if not immediately, addressing varicocele sooner rather than later may be beneficial. The effects on sperm production and quality can be cumulative and progressive. Research shows that earlier intervention generally yields better fertility outcomes than waiting until you're actively trying to conceive and facing difficulties. Similarly, if varicocele is contributing to low testosterone, addressing it earlier can help you maintain better energy, body composition, and overall health throughout your adult years, rather than experiencing gradual decline. This doesn't necessarily mean rushing into procedures, but it does mean not ignoring the condition or assuming it will never cause problems just because it hasn't yet. Whether you're managing varicocele naturally or have undergone professional treatment, long-term strategies are important for maintaining optimal health. The natural approaches discussed aren't temporary measures. They represent a long-term commitment to supporting your vascular health, hormonal balance, and overall well-being. Temperature management, nutritional support, appropriate exercise, and weight maintenance should become permanent lifestyle habits. Think of varicocele management like managing blood pressure or cholesterol. It's not about a quick fix, but about creating sustainable habits that support your body's natural functions over the long term. Perform monthly self-examinations of your testicles. This isn't just about varicocele, but about overall testicular health. You're looking for changes in size, consistency, or the development of lumps. Familiarity with what's normal for you makes it easier to detect changes early. For varicocele specifically, monitor for changes in the visibility or palpability of the dilated veins, changes in discomfort levels, or any new symptoms. Even if you're managing varicocele successfully with natural approaches and not experiencing problems, annual checkups with a healthcare provider are valuable. They can detect subtle changes you might miss and provide objective measurements over time. If you've had professional treatment for varicocele, follow-up assessments ensure the treatment remains effective and that no recurrence has occurred. Your management approach may need to adapt as you age and your life circumstances change. A man in his 20s who's highly physically active may need different strategies than a man in his 40s with a desk job and different health priorities. Be flexible and willing to adjust your approach based on what your body is telling you and what your health goals are at different life stages. If you don't have varicocele but want to reduce your risk of developing it, many of the same principles apply. Maintain healthy body weight, avoid prolonged sitting or standing, stay physically active with appropriate exercise, support vascular health through nutrition, and avoid activities that dramatically increase intra-abdominal pressure repeatedly. Varicocele doesn't exist in isolation. Your vascular health, Hormonal balance, fertility, and overall well-being are interconnected. The strategies that help manage varicocele also support cardiovascular health, metabolic health, and longevity. By taking control of this condition, you're not just addressing one specific issue. You're investing in comprehensive health that will benefit you in multiple ways throughout your life. Varicocele affects millions of men worldwide, yet it remains shrouded in silence and misunderstanding. Too many men suffer with symptoms they think are normal, or discover they have the condition only when facing fertility challenges that could have been prevented or minimized with earlier awareness and action. The key takeaways from this comprehensive guide are clear. Varicocele is common, affecting approximately 15% of men, and can have significant impacts on fertility, testosterone production, and quality of life. Recognition is crucial. Pay attention to scrotal discomfort, visible or palpable changes, and symptoms that might indicate hormonal effects. Natural management strategies focusing on temperature regulation, nutrition, appropriate exercise, weight management, and stress reduction can make meaningful differences in symptoms and progression. Professional evaluation is important when symptoms persist, fertility is a concern, or signs of testicular damage or hormonal dysfunction are present. Long-term commitment to healthy lifestyle practices supports not just varicocele management, but overall male health and vitality. This isn't about fear or worry. It's about empowerment through knowledge. Understanding your body, recognizing when something isn't quite right, and taking proactive steps to support your health are fundamental aspects of taking charge of your well-being. Varicocele doesn't have to be a silent condition that slowly undermines your health. With awareness, appropriate lifestyle modifications, and medical support when needed, most men with varicocele can maintain excellent fertility, optimal hormone levels, and freedom from symptoms. Your health is your most valuable asset. The information in this video gives you the tools to protect and optimize one important aspect of it. Take that knowledge, apply it consistently, and don't hesitate to seek professional guidance when needed. The conversation about men's health, including topics like varicocele that many find uncomfortable to discuss, needs to continue. By educating yourself and being willing to address these issues openly, you're not just helping yourself, you're contributing to a culture where men's health is taken seriously and where no one suffers in silence because of embarrassment or lack of information. Take care of yourself. Your future self will thank you for the actions you take today.